Okay, today we are discussing about the development of face. Face is developed by 5 processes. One frontonasal process, a pair of maxillary processes and a pair of mandibular arches. These 5 together forms the face. So face altogether formed by 5 processes. One is frontonasal process. One is frontonasal process and the next one is a pair of maxillary processes and a pair of mandibular arches. A pair of maxillary process and a pair of mandibular arches. These 5 together form the face. The front, usually the primitive mouth we call it as stomatodium. This stomatodium is bounded cephalically by the forebrain vesicle and caudally by the mandibular arch. So we know that the pharyngeal arches are 6 in number. Out of this 5th pharyngeal arch disappear. The first arch we call it as mandibular arch. So usually what happens is the primitive mouth. This is the primitive mouth. Primitive mouth which is bounded cephalically by the forebrain vesicle, which is bounded cephalically by the forebrain vesicle. Okay, so here we have primitive mouth is present here. Primitive mouth is present here. This will nothing but stomatodium. Okay, this is bounded cephalically. The primitive mouth is bounded cephalically by the forebrain vesicle and caudally by the mandibular arches. Mandibular arches is nothing but a pharyngeal arch, which is the first pharyngeal arch. We call it as mandibular arch. Okay, then what happens is the mesenchyme caudal to the forebrain vesicle, it proliferates. The mesenchyme caudal to the forebrain vesicle, it proliferates along with its ectoderm to form one process. We call it as frontonasal process. So the mesenchyme present caudally at the forebrain vesicles proliferates along with the ectoderm. Okay, it proliferates along with the ectoderm and it forms a process. We call it as forebrain vesicle. So the mesenchyme here proliferates here and it forms a process here. We call it as frontonasal process. The mesenchyme proliferates to form a process. We call it as frontonasal process. So usually the primitive mouth or stomatodium, this is the primitive mouth. This one we call it as primitive mouth or stomatodium. Okay, this is the primitive mouth or stomatodium which is bounded. So we can, this one is the stomatodium. Okay, this is the stomatodium or primitive mouth which is bounded cephalically by the forebrain vesicle and cephalically by the forebrain vesicle and caudally by the mandibular arches. Then what happens is the mesenchyme at the caudal end of the forebrain vesicle proliferates to form a process called frontonasal process. This is a process called frontonasal process. On either side of the frontonasal process, the ectoderm undergoes division and forms an elevation we call them as olfactory placodes. On either side of the front, this is the frontonasal process, right? So on either side of the frontonasal process, the ectoderm proliferates and form a placodes called, we call it as olfactory placodes. Okay. And then what happens is here is the mandibular arch. The mandibular arch divides it gives one dorsal maxillary process. The mandibular arch, it gives one dorsal maxillary process and this is the mandibular arch and the dorsal part we call it as maxillary processes. Okay, so we know that we have one frontonasal process is present here by the proliferation of the mesenchymal cell along with the ectodermal cells on the caudal part of the forebrain vesicle, as well as these are the mandibular arches. The dorsal part of the mandibular arch we call it as maxillary process. We know that mandibular arch is nothing but the first pharyngeal arch. We have totally 6 pharyngeal arches are present. Out of this 5th one disappear and the first pharyngeal arch we call it as mandibular arch and the second pharyngeal arch we call it a hyoid arch. That's a different point. Anyhow, the first pharyngeal arch we call it as mandibular arch. The mandibular arch, the dorsal end of the mandibular arch we call it as, the mandibular arch divides into a dorsal part we call it as maxillary process and the ventral part we call it as mandibular arches. Okay, so now we have frontonasal process is present here, a pair of maxillary process is present here and a pair of mandibular arches are present here. Okay, so then what happens is the mesenchyme of the frontonasal process, it proliferates. Then what happens is the these olfactory placodes, they are called as olfactory pits. The mesenchyme overgrown the olfactory placode. The mesenchyme overgrows the olfactory placodes, and these olfactory placodes, they undergo depressions. They undergo depression. We call it as olfactory pits. We call it as olfactory pits. These olfactory placodes, they form pits by the overlying growth, by the overgrowth of the mesenchymal cells of the frontonasal process. Okay, these are elevation, and later because of the mesenchymal cells division, they become pits. We call it as olfactory pits. These olfactory pits, they divide the frontonasal process into median nasal process and later see here, this is the frontonasal process, right? The entire one is the frontonasal process, and these two are the olfactory placodes. Then what happens is these olfactory pits, they divides the frontonasal process into median nasal process and to lateral nasal processes. Okay, so because of the formation of olfactory pits, the frontonasal process divides into median nasal process and lateral nasal process. Okay, then these are the two mandibular arches, and these are the maxillary processes. Then what happens is the median nasal process, which is present at the center, which is a median part of the frontonasal process, it undergoes caudally, it grows caudally and forms two processes called globular processes. Okay, the median nasal process is situated here. So this is the median nasal process. The two are the lateral nasal processes. The median nasal process, it grows caudally and form two processes. These two are the globular processes. Okay, so the frontonasal process, because of the presence of the olfactory pits, is divided into median and nasal processes. Then the median nasal process, it further grows caudally and form two processes. We call these as globular processes. Okay, separated by a notch. These globular processes are separated by a notch. Okay, then see here, the maxillary processes and mandibular arches, they grow and grow each other. So the maxillary processes are growing like this, and the mandibular arches, they are growing like this. Okay, then this is the primitive mouth itself. Okay, these are the primitive mouth. It is nothing but the primitive mouth. We call it as stomatodium. And then what happens is the maxillary processes, they grow ventromedially. The maxillary processes, they grow ventromedially and they join with the lateral nasal processes. Before joining with the lateral nasal processes, a naso-optic furrow is present between the lateral nasal process and maxillary process. This is the naso-optic furrow. This is the naso-optic furrow. Okay, the naso-optic furrow present in between the maxillary processes and lateral nasal process. We know that these two are the lateral nasal processes, right? Lateral nasal processes, and this is the median nasal process, right? So the median nasal process, it grows caudally and forms the globular processes. Then what happens is the maxillary process, it grows ventromedially and joins with the lateral nasal process. So before joining with the lateral nasal process, a naso-optic furrow present in between the maxillary processes and lateral nasal process. Okay, the ectoderm of the two processes, they emerge with each other. The ectoderm of the superficial part of the ectoderm, they emerge with each other. They emerge the lateral nasal process and the maxillary process. The superficial part of the ectoderm, they emerge with each other. The deep part grows below the overlying mesenchyme, below the underlying mesenchyme, and form a duct. We call it as nasolacrimal duct. So this naso-optic furrow, in future it forms the nasolacrimal duct, which communicates the lateral wall of the nasal cavity to the conjunctival sac. That is called nasolacrimal duct is developed here. Nasolacrimal duct, because at the naso-optic furrow, what happens is the ectoderm, it surrounds the underlying mesoderm. It surrounds the underlying mesoderm and forms a tubular duct. We call it as nasolacrimal duct. Okay, so here, apart from nasolacrimal duct, what happens is these lateral maxillary processes, they grow ventromedially and meet with the lateral nasal process. These lateral nasal processes, in future, they form aloe of the nose. Okay, these lateral nasal processes, in future, they form the aloe of the nose. And one more important thing is, it fused at a primitive stomatodium. The angle of the mouth is present here. The angle of the mouth is present here near the auricle. Then what happens here is the maxillary processes and mandibular arches, they grow and they bring the angle of the mouth to here. Okay, to the normal position. Usually the angle of the mouth is present here at the near the auricle, and the maxillary processes and mandibular process, they grow and they bring the angle of the mouth here to the normal position. Okay, so that is about the formation of face. Okay, and one more thing is the median nasal process, it grows caudally to form the globular swellings. So globular processes, they form the fill rim of the upper lip. These globular processes, they form the fill rim of the upper lip. And one more thing is the maxillary process, as they are growing towards the ventromedially, because of the force exerted by the maxillary processes, the median nasal process, it grows and the nose, it gets separated from the remaining part of the face by a riser ridge, and the median nasal process forms the nasal septum, and the lateral nasal processes, they forms the ala of the nose. Okay, so because of the force exerted by the maxillary processes, the nasal septum gradually rises. The nasal septum gradually rises, the median nasal process gradually rises and it forms the nasal septum. Okay, so that's about the median nasal process and lateral nasal process. Later what happens is these globular swellings, they unite and they form the fill rim of the upper lip, and the maxillary process, it forms the remaining part of the upper lip. And so the maxillary processes, it forms the upper cheek, upper jaw, and also upper lip, a part of the upper lip except the fill rim. The fill rim of the upper lip, it is developed by the median nasal process, nothing but from the globular processes. Okay, and the angle of the mouth, it is present near the auricle. Because of the growth of the maxillary process and mandibular arches, the angle of the mouth comes to the normal position, and the lower jaw and the lower lip, it is formed by the growth of the mandibular processes. So frontonasal process, it forms the nasal septum and ala of the nose and fill rim of the upper lip. Maxillary processes, they form the upper cheeks. Maxillary process, they form the upper cheeks and upper jaw, and they also forms the part of the lip. And mandibular arches, they form the lower jaw, lower lip. And one more important thing is, because of the growth of the maxillary processes towards ventromedially, the stomatodium, the primitive mouth, separates from the nasal cavity. The primitive mouth separates from the nasal cavity because the growth, usually the primitive nails here at present in primitive stage, the primitive nails comes in contact directly with the stomatodium. Then what happens is, because of the growth of the maxillary process, the stomatodium gets separated from the nasal cavity. Okay, that's about the face. So the face, it is developed from five processes. One is frontonasal process, and the remaining two are a pair of maxillary and a pair of mandibular arches. This frontonasal process is formed by the proliferation of the mesenchymal cells in the caudal part of the forebrain. So the frontonasal process, on either side of the frontonasal process, and ectodermal elevations are present. We call it as olfactory placodes. And what happens is, because of the overgrowth of the mesenchyme, these olfactory placodes, they become pits. We call it as olfactory pits. And the median nasal process, it divides into the frontonasal process, it divides into median nasal process and lateral process because of the olfactory pits. And from median nasal process, it goes growth caudally and it forms the globular swellings. And what happens here is, these globular swellings, they are separated by a notch here, and what happens here is, further the globular swellings, they unite and they form the fill rim of the upper lip. At the same time, the maxillary process comes in to unite with the lateral nasal process. This lateral nasal process in future forms the ala of the nose. Because of the driving force of the maxillary process, the nasal septum, the median nasal process, it rises and forms the nasal septum here. And here one more thing about the maxillary process, they forms the remaining part of the upper lip except for the fill rim, which is developed from the median nasal process. Okay, in primitive stage, the angle of the mouth, it is situated near the arcle. Because of the growth of the maxillary processes and the mandibular arches, the angle of the mouth comes to the normal position, and the maxillary process, they form the upper cheek, upper jaw, and also they forms the part of the upper lip except the philtrum, and the mandibular arches, they unite and they form the lower lip and lower jaw. And when that's about the development of face. Okay, sometimes what happens is sometimes the maxillary process is failed to unite with the median nasal process. Here we have a cleft here, that is called facial cleft. This is called facial cleft. And sometimes what happens is the maxillary process on either side, it fails to unite with the lateral nasal process, then we call it as bilateral facial cleft. Okay, and sometimes what happens is the maxillary and mandibular process, they fail to unite with each other, then we have a large mouth, we call it as macrostomia. And sometimes what happens is we have the maxillary and mandibular process, they attach each other, they grow more, the mouth becomes small, we call it as macrostomia. Okay, so that's about the development of face. Shiva, in diagram is. So now we are discussing about development of palate. So the primitive palate. The primitive palate, it is formed by the globular process of median nasal process. We know that the globular processes, they are nothing but the median nasal process, it grows downwards and forms two globular nasal processes. We know that because of the olfactory pits, the frontal nasal process divides into median nasal process and lateral nasal process. So we know that the median nasal process, this median nasal process extends downwards and forms the globular process. They form the philtrum of the upper lip, and also these globular processes, they extend backwards and they form the primitive palate. This is the primitive palate, and this is the nasal septum, which is nothing but the median nasal process, the caudal border of the nasal septum. This is the caudal border. When we are seeing the section through below the palate, okay, when we are seeing the section through below the palate, this is the primitive palate, which is formed by the globular processes, and this is the nasal septum, which is the caudal border of the nasal septum, Okay, and also from the maxillary processes, a shelf-like projections extends downwards and medially. We call them as palatine processes. From the maxillary processes, these are the maxillary processes which are responsible for the formation of upper cheek, upper jaw, and also part of the on the sides of the upper lip, right? These maxillary processes, they form shelf-like projections which grow inside from ventromedially. They form downwards and medially, they form palatine processes. Shelf-like projections from the maxillary processes, shelf-like projections extend, they are called palatine processes. So this is the primitive palate and this is the nasal septum. Later on what happens is the palatine processes, they unite with the primitive palate. First, the palatine processes, they unite with the primitive palate, as well as the palatine process, they across the midline, they unite with each other. They unite with each other and they unite with the caudal border of the nasal septum, thus separating the nasal cavity from the oral cavity. Because of the presence of hard palate, the nasal cavity and oral cavity get separated from each other. Because of the palatine processes, they unite in a Y-shaped manner. What happens is, thus first the palatine processes, they unite. The palatine processes, they unite with the primitive palate, we can call it as premaxilla, and then they unite here like this. The palatal process, they unite with each other, okay, thus separating the nasal cavity and oral cavity. And one more thing is the ventral part of the palate. The ventral part of the hard palate, it undergoes ossification. The ventral part of the hard palate, permanent palate, it undergoes ossification. That's why we call it as hard palate. And the dorsal part of the palate, it does not undergo ossification and it hangs like a curtain, and it does not fuses with the nasal septum also. It does not fuses with the nasal septum and it does not undergo ossification. It remains as the soft palate. So the hard palate, it undergoes ossification, that's why we call it as hard palate, which separates the oral cavity from the nasal cavity, and the soft palate which doesn't undergo ossification and hangs as a curtain and doesn't unite with the caudal border of the nasal septum. Okay, so that's the development of palate. So the development of palate, it is taken by the primitive palate and also the palatal processes of maxilla. The primitive palate, it is formed by the maxillary process. The primitive palate, it is formed by the globular process of the median nasal process. The globular processes, these are the globular processes. These globular processes, they form the filtrum of the upper lip as well as they form the primitive palate. Then what happens is the processes which arise from the maxilla, we call this as palatal processes. Palatal processes are shelf-like projections which arise from the downward projections from the maxillary processes. What happens here is they unite in a Y-shaped manner. These palatal processes, they unite with the primitive palate and they unite with each other and they fuse with the caudal border of the nasal septum, thus separating the nasal cavity from oral cavity. And the ventral tooths of the palate, they undergo ossification and forms the hard palate, and the dorsal 1/3 of the palate, they doesn't undergo ossification and hangs as a curtain, and also it doesn't unite with the dorsal and it doesn't unite with the caudal border of the nasal septum and remains as a soft palate. Okay, sometimes what happens here is one palatal process, it doesn't unite with the maxilla, then we have cleft palate. It unites with the, so if the palatal process, if doesn't unite with the premaxilla, then we have cleft palate. And if the palatal, and one more thing is sometimes the facial cleft extends here to the palate, then we call it as a cleft palate or cleft lip. Usually cleft lip and cleft palate, they are associated with each other. If sometimes the two palatal process, they doesn't unite with the primitive palate, they doesn't unite with the premaxilla on both sides, we call it as bilateral cleft palate. And sometimes it is united with the, sometimes it is related to the bilateral cleft lip also. So bilateral cleft lip and bilateral cleft palate are present. Sometimes what happens is we have these palatal process, they doesn't unite with each other, we have complete cleft in the palate. Okay, so these are the various anomalies of the palate. So first the palate has to unite with the premaxilla in a Y-shaped manner, and the palatal process together unite in a Y-shaped manner to form the hard palate, which are dorsal to 1/3 remains a soft palate, doesn't undergoes ossification. So that's about the palate. And coming to the tongue, so the tongue, it is the organ of taste. Okay, so tongue is the organ of taste because numerous taste buds are present in tongue, right? Numerous taste buds are present in tongue. So the tongue, how the tongue is formed? We know that the pharyngeal arches are 6 in number. Out of this, fifth arch is disappear. The pharyngeal arches are lined by the nothing but the mesodermal bars, lined by outside covering by the ectoderm and in the inside lined by the endoderm. So the pharyngeal arches have this core of mesoderm is present, and we have various derivatives from the pharyngeal arches. The pharyngeal arches, they give rise to skeletal masses, and also they give rise to arteries, and also they give rise to nerves. So the pharyngeal arches, we will discuss the pharyngeal arches in detail later. So first we will discuss with the development of tongue. Okay, so development of tongue, the medial most parts of the first pharyngeal arches, the medial-most parts of the first pharyngeal arches, they proliferate to form two lingual swellings, two lingual swellings. These lingual swellings are because of the underlying mesenchyme. The underlying mesenchyme proliferates and form two lingual swellings from the first arch. So the first arch, the medial most parts of the first arch undergo proliferation. The medial most parts of the first arch. Okay, first arch we call it as mandibular arch. The medial most parts of the first arch, they undergo proliferation and form two swellings. We call it as lingual swellings. Okay. And also they form another swelling, we call it as tuberculum impaired. Unpaired swelling is present, we call it as tuberculum impaired, and just behind the tuberculum impaired we have a depression is present. Just behind the tuberculum impaired we have a depression is present. This depression gives rise to thyroglossal duct from which the thyroid gland develops. This depression gives rise to from which the thyroglossal duct descends downwards and which gives rise to thyroid gland, the place where the thyroglossal duct descend downwards. This depression we call it as foramen cecum. This depression we call it as foramen cecum. Okay. Foramen cecum is present. Foramen cecum is present behind the tuberculum impaired. So two lingual swellings, and this is the tuberculum impaired. Okay, tuberculum impaired. So the medial most parts of the first arch, it undergoes proliferation to form one pair of swellings and one unpaired swelling. We call them as two lingual swellings and one tuberculum impaired. Behind the tuberculum impaired we have a depression from which the thyroglossal duct descends downwards, which gives rise to thyroid gland in future. The place where the thyroglossal duct descends downwards we call it as foramen cecum. Okay, and the medial most parts of the second, third and fourth arches, they also proliferate. The medial most parts of the second, third, fourth arches, they also proliferate and form one eminence. We call it as hypobranchial eminence. We call it as hypobranchial eminence. We call this one as the hypobranchial eminence. So this is the hypobranchial eminence. Okay, this hypobranchial eminence which divides the this hypobranchial eminence consists of cranial part as well as caudal part. Okay, so the medial most parts of the first arch proliferates to form three swellings. Out of this, one are paired swelling, they are called lingual swellings, and next one is unpaired swelling, that is tuberculum impaired. In the behind the tuberculum impaired we have a depression that is called foramen cecum, from which the thyroglossal duct descends. The medial most parts of the second, third and fourth arches, they proliferate, they form another swelling, we call it as hypobranchial eminence. So this hypobranchial eminence divides into cranial part and caudal part. Okay, now how the tongue develops. So the tongue develops from the anterior. We know the tongue divides into anterior 2/3 and posterior 1/3, right? The sulcus terminalis which divides the tongue into anterior 2/3 and posterior 1/3. The anterior 2/3 of the tongue, it is developed by two lingual swellings and tuberculum impaired. Two lingual swellings and tuberculum impaired, they form the anterior 2/3 of the tongue. So we know that the mesenchyme of the third arch grows over the mesenchyme of the second arch. Okay, the mesenchyme of we know that the hypobranchial eminence, it is formed by the proliferation of the second, third and fourth arches. The mesenchymal cells, proliferation of the mesenchymal cells of second, third and fourth arches. Here what happens is the mesenchyme of the third arch or the mesoderm of the third arch grows over the mesoderm of the second arch. Okay, here the cranial part and this is the caudal part. The cranial part of the hypobranchial eminence, it forms the posterior 1/3 of the tongue. The cranial part of the hypobranchial eminence, it forms the posterior 1/3 of the tongue. Posterior 1/3 of the tongue, it is developed from the cranial part of the hypobranchial eminence, and the caudal part of the hypobranchial eminence, it forms the posterior most part of the tongue. It forms the posterior most part of the tongue as well as the epiglottis, So that's about the development of tongue. Okay, though the anterior 2/3 of the tongue is developed from two lingual swellings as well as the tuberculum impaired, and the posterior 1/3 of the tongue, it is developed from the cranial part of hypobranchial eminence. Coming to the nerve supply of the tongue. Okay, So, what is the nerve of first arch? The nerve of first arch is the mandibular nerve. So, the anterior 2/3 of the tongue, it is supplied by lingual nerve, which is nothing but a branch from the mandibular nerve. The nerve of first arch is the mandibular nerve. Okay. So, the lingual nerve supplies the anterior 2/3 of the tongue. Lingual nerve supplies the anterior 2/3 of the tongue, which is a branch from the posterior division of the mandibular nerve, which is a branch from the posterior division of the mandibular nerve, which is the post-traumatic nerve of first arch. Usually, each arch consists of two nerves, post-traumatic nerve and pre-traumatic nerve. At the cranial side we have post-traumatic nerve, and at the caudal side of each arch we have pre-traumatic nerve. All the pre-traumatic nerves, they degenerate, all the pre-traumatic nerve, they disappears, except for the first arch the pre-traumatic nerve remains. With that one we call it as cauda tympani nerve. So the first arch consists of both post-traumatic nerve as well as the pre-traumatic nerve. Usually all arches at the primitive stage consists of post-traumatic nerve as well as the pre-traumatic nerve, but all the pre-traumatic nerve disappear except for the first arch, which remains, that is the cauda tympani nerve. So cauda tympani nerve is the pre-traumatic nerve of first arch. So pre-traumatic nerve of first arch. Okay, pre-traumatic nerve of first arch. Cauda tympani nerve is the pre-traumatic nerve of first arch, which remains, but all the traumatic nerves, they disappear. Okay, so the anterior 2/3 of the tongue, it is supplied, the dental sensation, it is supplied by the lingual nerve, which is a branch from the mandibular nerve. So the mandibular nerve, we know that it is the nerve of first arch. The mandibular nerve is the nerve of first arch, and the facial nerve is the nerve of second arch, and the glossopharyngeal nerve is the nerve of third arch, and superior laryngeal nerve is the nerve of fourth arch, and recurrent laryngeal nerve is the nerve of sixth arch. Okay, so these are the different nerves which are related to the five pharyngeal arches. Out of this, fifth one disappears. These are the different nerves which are related to the pharyngeal arches. So the nerve of first arch, we call it as mandibular nerve. A branch from the mandibular nerve supplies the anterior 2/3, because we know that the lingual swellings are tubercle limpar are developed from the proliferation of the mesenchymal cells of the first arch. Okay, thus way, because it is developed from the anterior 2/3 of the tongue, it is developed from the first arch. Thus way, it is supplied by the first arch nerve, nothing but the mandibular nerve. A branch from the mandibular nerve, we call it as anterior, which call it as lingual nerve, which supplies the anterior 2/3 of the tongue general sensation, and the taste sensation for the anterior 2/3 of the tongue, it is carried out by the pre-traumatic nerve of the first arch. We call it as cauda tympani nerve. And coming to the posterior 1/3, what is the nerve of fourth arch? The fourth arch nerve is the glossopharyngeal nerve. So the glossopharyngeal nerve, which carries both taste and general sensation for the posterior 1/3 of the tongue. And coming to the posterior most part of the tongue, which is supplied by the superior laryngeal nerve, which is the nerve of fourth arch. Okay, so this is because the mesenchyme of the first arch grows over the mesenchyme of the second arch. The facial nerve doesn't supply the tongue, because the mesenchyme of the first arch grows over the mesenchyme of the second arch in the formation of hypobranchial eminence. So the facial nerve does not play any role in the nerve supply of the tongue, except a branch from the facial nerve, which is a pre-traumatic nerve, which supplies the anterior 2/3 taste sensation. Okay, so that's about the nerve supply of the tongue. So anterior 2/3 of the tongue is supplied with the lingual nerve, which is general. It carries general sensation fibers, and the taste sensation fibers, they are carried by the cauda tympani nerve, and the posterior 1/3 of the tongue, it is supplied by the glossopharyngeal nerve, both general and taste sensation. It is carried out by the glossopharyngeal nerve, which is carried out by the glossopharyngeal nerve, both general and taste sensation, and the posterior most part of the tongue, it is supplied by the superior laryngeal nerve. So that's about the nerve supply of the tongue. And one more thing is the tongue muscles, they are developed from the occipital myotomes. The tongue muscles, they are developed from the occipital myotomes. The nerve of the occipital myotomes is the hypoglossal nerve. That's why when the tongue muscles migrate, the hypoglossal nerves also comes along with the occipital myotomes. So the hypoglossal nerve supplies all the muscles of the tongue. The motor supply of the tongue is carried by the hypoglossal nerve, which is the 12th cranial nerve of the body. The tongue muscles are developed from occipital myotome. This word is very important. Occipital myotomes, which gives rise to tongue muscles. Okay. And all the tongue muscles, they are supplied by the hypoglossal nerve. So that's about the tongue. Here, I will